This patient came to the office because she was very unhappy about those standard porcelain restorations that had been in her mouth for a couple of years. For some reason, some principles of cosmetic dentistry were entirely ignored. The most obvious, which is basically the baseline for any cosmetic dentistry, is the asymmetry of the gum line. Having the zenith of the gums on the left side right here and the zenith of the gums on the right side right here. So it's already basically a canted look, which makes this tooth longer and makes this tooth shorter. Obviously, we have this big diastomer here. Then the distance between this tooth and this tooth, it's not that visible, but it's greater than on the other side. So this one is a little bit shorter from here to here. This tooth is shorter than this tooth, which is hiding under the lip. And the smile is overall considered gummy. So what did I do? I did, as a first step, some gum lift to even out the discrepancies between left and right. Let the gums heal, placed long-term provisionals, and after the healing process, I placed the porcelain restorations. And here we can see that there is much more symmetry in her smile, or to start with, at her gum line. These two teeth now have a more equal length. The zenith is up here and is up here. And if we orient ourselves with the upper lip, which is never absolutely symmetrical, and there is a little pull-in of the lip, and there's a little pull-in of the lip, it is much more symmetric than before. Here also we have very pronounced mamelons to give her a real cute, lively, youthful look. We have the same here. And again, a halo effect down there. With a transition of colors, which is called polychromaticity, which means many colors. In addition, the space has been closed, and we established again an opening of those triangles as we move towards the back. So these angles open up to add to the youthful look. Cosmetic dentistry is not restricted to any particular age group. I have patients coming in that are 17 years old, up to patients who are in their 80s. And this lady, I don't recall exactly the age, but I believe she was short before 80 years old. And she still wanted to handle her smile and feel more comfortable about how she would be considered by other people she would be talking to. And she likes to smile a lot. Now, there we have a good example of signs of regular physiological wear and staining. Dentistry done by general dentists, standard traditional dentistry with porcelain-fused metal crowns and amalgam fillings. She was not interested in doing anything about the amalgam filling because it still sealed her teeth, but she didn't really like all these aspects, like a dark triangle here, which a lot of patients complain about. So she had this dark triangle here she wanted to eliminate. She didn't like the proportions of the incisors. There is a sign of wear. There's a sharp line angle here. Really signs of wear at the incisal edges. And really square looking teeth. There's not really a nice embrasure design that makes the tooth look more youthful. or roundness of this incisor. In addition, this incisor is longer than the central incisor, which is not necessarily aesthetic either. So this is how she looked afterwards. We established those incisal embrasures. We opened them up from almost nothing to a little bit more to definitely more, and the angle opens up even more here. Here's the amalgam filling that she had before. The proportions between central and lateral incisors are more correct. Again, we have a youthful look because we have polychromaticity, and let me draw that in green, as I did earlier. So we have polychromaticity from here to here. Then we have translucency here, as you can see here. And again, the halo effect. We selected a little bit more rounded canine and rounded off this incisor as well, which attenuated the idea of worn or aged teeth. These teeth look significantly younger than before. And obviously she was very happy about that.